So I work in the emergency department at St. Luke's. Been working there for 15 years or so. And I was just noticing over the course of time that patients seem to be more complex, more medical problems. The list seemed endless, equally long list of medications as well, which had their own side effects. And patients seem to have more chronic medical issues. So this led me to doing some more personal education. So I started to pursue just courses that were non-credit. These were through the GREAT courses, which I would highly recommend to anybody. I started with a course on stress in your body. The next one I did was nutrition. I was kind of shocked that I knew so little about nutrition, and then realized I'd never really learned nutrition in medical school. The last one I took, which was a mind-body course, and this was really profound for me because I was really beginning to understand the connection between the mind and the body, how they affect one another, mind affecting physical illness, illness affecting the mind and mental health. So I pursued a fellowship in Integrative Medicine at the University of Arizona and completed this around a year ago. In that coursework, inclusive of conventional medicine, so it includes everything that I'd already learned in my Western medical education. I was learning about nutrition, stress management through things like meditation, yoga practice, Tai Chi. I was learning about botanicals and supplements, environment in medicine, and then also learning about other world health traditions such as Ayurvedic medicine and traditional Chinese medicine. So I was around 6 months into the fellowship when I had my own personal tragedy. My partner of 5 years passed away in a motorcycle accident. And I really felt it was profound to me that I was doing the fellowship at the time, because I was learning things to help take care of my patients, but then found myself using these things to actually help keep myself well at that time. In turn, I think the experience that I had, just the personal experience as well as what I was learning, was really helping me take better care of my patients. You know, my own self-compassion was translating into more compassion for my patients. Where I might have been inclined to judge patients for maybe bad habits, I kind of left that at the wayside. And I just leaned in and decided that no, I could be more generous and be more compassionate, and realize that compassion was really helpful in terms of the healing process for those patients. So, I mean, then at that time, and even more so now, I feel like it's a critical ingredient to helping patients, heal and get better. We say in integrative medicine that healing is possible even if curing is not. And I think that the connection with patients that you get by showing that level of attention and compassion is really critical to their healing process, as well as in turn heals the healer.